If you have grown up in the US, then you know that during your annual physicals, there's a lot of different types of blood tests that your clinician will order. And it's usually a huge laundry list. It's difficult to decipher. It can be confusing. And though I have some good videos on what tests to consider that I think are quite valuable to help you age healthy, age well, here are a few blood tests that I consider low value, meaning not only would I not put a lot of stock in them if they are abnormal, but I probably wouldn't check them in the first place. One thing to understand about medicine and healthcare is that it's very data rich, but unfortunately, most of it is noise, not an actual important fact, what we call signal, something that signals something important. And the reason that can be problematic is if you go to your primary care doctor or your specialist and you have certain tests ordered, if they are abnormal in any way, your doctor is probably going to want to check them out, go deeper into them, order other tests. So one test creates another test, creates another test, creates anxiety, creates follow-up visits. Not only does it become costly, but it distracts you from what's important to you. Healthy aging, feeling well in your body, avoiding chronic diseases, which is what I really talk about. So welcome to the channel. My name is Dr. Ashori. I'm a board-certified family medicine physician. I'm an MD. And the health coaching that I do is mostly focused on healthy aging. And just as important, just as I consider certain blood tests very important, I consider these tests quite unnecessary. Of course, this is for somebody who's healthy, who's feeling well. We're talking about a screening test where you don't have any symptoms. So number one on my list is your hemoglobin and hematocrit. So of course, somebody might say, but I'm very anemic. I have severe fatigue. Again, this is talking about somebody who has no symptoms, who doesn't feel a lot of fatigue, feels pretty healthy, feels good. Checking their hemoglobin or hematocrit to indicate any lack of red blood cells or function of red blood cells is of low value. Even if it's a little bit high, if it's a little bit low, it really doesn't tell us much. You would just end up getting a lot more tests, which just complicates things. The next one I have is vitamin D. So there's a lot of studies that show associations between low vitamin D and certain medical conditions. Yes, people who don't eat well, don't get a lot of sun or exercise, especially they don't exercise outside, they're going to have a low vitamin D, and so they're going to have a lot of medical conditions. But it doesn't mean that if we bring up the vitamin D, these conditions are going to go down. In fact, there are some really good studies to show that changing somebody's vitamin D level through supplementation probably is not going to change their outcome as much. So for that reason, having a vitamin D level checked is of little value, unless, of course, you're experiencing symptoms that could be associated with vitamin D, low vitamin D. TSH is another one, very commonly checked. It's a thyroid test, and there are many different types of thyroid tests. Again, if you have symptoms of elevated thyroid or symptoms of low thyroid, which is called hypothyroidism, absolutely, you should have a very thorough investigation, the least of which should be a thyroid. There are many other tests to do to figure out why somebody might have low energy, constipation, skin changes, hair changes, mood changes. But TSH is not very effective, and so whatever the results are, I would generally not put a lot of emphasis in it. I just had this discussion with my own mother who had a TSH done. It created havoc. The doctor decided to order this TSH. It was quite abnormal. She had no symptoms. She had many other tests done. She had quite invasive tests done for her thyroid. And in the end, she chose to discuss the case with me. I try not to be a physician for my family members, but she decided to discuss it with me, and in the end, everything's fine. The next one on my list is the CBC, but specifically the WBC. So a CBC is something that many of us get on our lab tests annually, and it does include the hematocrit, the hemoglobin, the leukocytes, the neutrophils, the platelets. It's of very little value unless somebody comes in with very specific symptoms. So whether your WBCs, your white blood cell count is high or low, in general, I wouldn't put a lot of emphasis on that, and I probably wouldn't do much about it. Unfortunately, once you get the test and it's abnormal, yes, it's going to create a lot of anxiety, and I doubt that your physician's just going to let it go. You might not even be able to let it go, so you might just pursue it to figure out what's wrong with it. The next one is electrolytes, magnesium, calcium, sodium, potassium, chloride. All of these things are of very little value. The actual amount of magnesium, potassium you have in your body is not very well reflected in the blood tests that we do. Sodium is a little bit better, but many of us can have a low sodium from time to time. We can have a higher sodium from time to time. And most of the tests that we do, often it's called like an electrolyte panel, a CMP, or a basic metabolic panel. These things often have some abnormality. One of these things is going to be abnormal. The creatinine in there, the B1, these are function of your kidney function tests, which we're going to get into. They're going to be abnormal. They're going to be a little bit off, but they're not going to tell you what's wrong. And again, they can create a lot of anxiety. So it's not something that I check. Kidney function test is another one. Of course, physicians in the longevity space, those who are focused on longevity, which is living as long as possible, they're very proactive about not only just checking your creatinine, but other metabolites for kidney function tests, ultrasounds, MRIs, etc. On my channel, I talk about healthy aging, which is quite different from longevity. And for those reasons, checking your kidney function, if you're doing all the right things, if you're healthy, if you don't have any risk factors for having abnormal kidney function, is of little value. The last one I'll throw in there is liver tests, but with a caveat. I do like liver tests as a way to gauge somebody's cardiometabolic status. However, if somebody is exercising, eating well, stress level is good, weight is good, checking their liver function test is of very little value. We do have some good data to say that, hey, maybe checking somebody's hepatitis C at some point in their life or even hepatitis B can be important, because if we know you have it, we have great treatments for it. So I hope this is of value to you guys. Check out drashori.com. That's DRASHORI.com. Take care.